Assalamu alaikum guys, welcome back to my YouTube channel. So the topic of discussion for today is pterygium. It's a very important topic and we see a lot of patients in the IOPD regarding this case. And the main problem of this disease is that the recurrence of this disease is very high, around 80%. So that's why we're going to discuss in detail the pathology, the causes and the treatment complications, how to prevent the recurrence of this disease. So let's get into it. So pterygium is defined as the degenerative condition of the conjunctiva in which there is the fibrovascular connective tissue overgrowth of conjunctiva which approaches the cornea. So as you can see it in the image here, this growth, it arises from conjunctiva. It's a fibrovascular degenerative condition that it grows. It usually it can occur on medial or on the lateral aspect, but usually it arises or can happen on the medial side usually. So it arises and it is progressive, that means it slowly and gradually increases in size until it approaches the cornea, and still it doesn't stop. It goes and until eventually, if you do not treat it in time, it can hamper your vision by crossing the pupil. At the end it can cross the pupil and you won't be able to see. The shape or the growth of this is usually triangular in size and shape, you can see. And this is usually another name for pterygium is surfer's eye, because in surfers the condition or the elements are ideal for the growth of pterygium, that is dry and hot weather and windy weather. So another name for pterygium is surfer's eye. So if we talk about the causes of pterygium, why does it arise, what can happen? In some people it arises and other people it doesn't. Well, the first most cause is that it is unknown. We do not know the exact cause of it, but there have been association, or we can say there are some factors which are thought to promote the growth of pterygium. So the first most is UV radiation. So people that are exposed to UV radiation in areas where there are more UV light, where there's more UV light rays, you can say, they have association with this disease. Apart from that, hot and dry and windy weather, which we discussed earlier, that is why surfer's eye name is used for it. Other than this, there are certain predisposing factors, that is the chronic infection of the conjunctiva, that can also lead to this disease. And apart from that, dusty atmosphere. So all these factors can predispose or promote the growth of pterygium. Now let's come to the pathology of this disease. So pathology, we can say that they're basically subconjunctival tissues. They undergo elastotic degeneration and proliferate as vascularized granulation tissues under the epithelium, which ultimately encroaches the cornea. And when it does encroaches the cornea, the corneal epithelium, the Bowman's membrane and the superficial stroma, they are destroyed. Now let's come to the types of pterygium. So there's progressive, stationary and regressive. Progressive, as the name suggests, that this pterygium progresses. It doesn't stop until it reaches the cornea or encroaches the cornea and hampers your field of vision. So you have to remove this on time before it can cause its devastating effects. Second one is stationary. It is present in that area but it doesn't progress nor regress. It's present and at the same position and the same size, shape will be present. The third one is regressive. Now in this regressive, the name suggests that regress, you mean it will regress, it will be shortened, but that's not the case. So regressive pterygium is a thin, atrophic with very little vascularity pterygium with no infiltration at the anterior edge. Now let's come to the stages of pterygium, but before we go into the stages, let's discuss the parts of pterygium. If we can divide it, how many parts we'll divide this into? We will divide this into three parts: the body, the neck and the cap. You can see it in the image here. Now let's come to the stages. We can divide this into three stages. Some people divide it into four, but we will divide it into three stages here. So the first stage, in which there is the pterygium approaches the cornea, but it doesn't cross more than 2 mm over the cornea. So it's less than 2 mm. Between 0 and 2 mm, the growth of pterygium over the cornea. This is stage 1. So in this one, no treatment is required. We usually we tell the patient to have checkups from time to time and we just observe. We can give them medical treatment for this, but there's no need for any surgical treatment. Then comes the stage 2, in which the growth is increased now, but it's between 2 mm and 4 mm. What I mean is that it is covering between 2 mm and 4 mm of the cornea. So in this one it depends. We can either still observe the patient, or if the patient wishes it to be removed, then we can remove it, surgically remove it. And in the third one, the pterygium has progressed so much that it covers now more than 4 millimeters of the cornea, and it approaches the pupil, and his vision is being hampered at this stage now. In stage 2, the vision, there was no hampering with the vision. The light rays can still pass the pupil. The pterygium was not at the stage where it actually covers the pupil, but it does cause astigmatism in stage 2 because it has this pull on the cornea, and the cornea is responsible for about more than half of the refractive error of the eye. So if the shape of the cornea is hampered, we know there are different diseases of the eye in which the cornea shape is hampered, then this results in refractive errors such as keratoconus. So in this one, if this causes astigmatism, this disrupts the normal refractive power of the cornea, and this will cause refractive errors in the patient. He will need glasses or spectacles. And so for stage 3, we do need surgery. It is immediate, and it is the only treatment for this. So let's come to the treatment of pterygium now. Now there is non-surgical or medical treatment and surgical. In non-surgical medical treatment, we can give artificial tears for dryness of eyes, and because it occurs in people living in dry areas, dry and hot weather areas. So for dryness of eyes, we can give teardrops, artificial tears, and we can tell the patient to wear sunglasses to prevent them from UV light. And other than that, we can give steroids, to prevent or to decrease the inflammation. Now let's come to the surgical treatment, which we discussed earlier. In stage 1, it is not needed unless the patient wishes to go for because of cosmetic reasons. But in stage 2 and stage 3, to prevent the visual loss, we do need this, and it's urgent. There is no other option. So the procedures are of 2 types. In one procedure, we can undergo simple excision. It is known as bare sclera technique. We just remove the pterygium, and we do not replace it, and there's no conjunctival flap inserted or anything. So it's bare sclera because the sclera is just bare as it is. There's no other, we do not place any other conjunctival flap or anything to cover that area. So the other one is simple conjunctival flap excision, and the covering of that bare area now with a conjunctiva or any other part such as amniotic membrane part. We can have multiple flaps here. Now let's come to the post-operative complications. Now one of the most aggressive complication of this disease is that, and in 80% of cases we see this, is the recurrence of the pterygium after removal, and it occurs in 80% of individuals. And that is why during surgery we use the technique of grafting. That is, we don't leave that area as it is, the bare sclera area where we just remove the pterygium. We replace it with the amniotic membrane graft or any conjunctival flap or anything, because to prevent the recurrence. We'll come to that now, to the how we can prevent the recurrence. And the second one is pyogenic granuloma. A fast growing granulomatous hemangioma can develop after surgical removal. So let's come to the prevention of complication. So the most common, the aggressive one, is the recurrence. So to prevent this recurrence, we can that area, the bare sclera area that is left, we can replace it with a conjunctival autograft or an amniotic membrane graft. We can place it in that area, and this will prevent the overgrowth or the recurrence of pterygium. It is very successful, and it is very common, and it is commonly used these days. Apart from that, we can give mitomycin drops in that area after surgery or during the time of surgery. Other than this, we can give radiation during the first week of surgery, post-op, and the dose of radiation is 2500. We can also use argon laser to prevent the regrowth of new vessels, especially at the limbus region. And the last one is peripheral lamellar keratoplasty. It can be used for deep lesions. Peripheral lamellar keratoplasty is basically the removal of that cornea which is damaged and replacing it by a donor's cornea. So this is the last stage of treatment where you have to remove the damaged cornea. So guys, after watching this video, I hope you got a brief idea about pterygium. If there are any more questions in your mind, please do comment and I will try to answer them. Until my next video guys, take care.